Welcome to the Your Company Health Podcast. I'm your host, Andre Wright, founder and CEO of the Wright Consult Digital Marketing Agency, and also the creator of the Patient Buzz program. The goal of this podcast is to highlight healthcare professionals, their journey, and how they're making the world a better place. Let's dive in. Welcome to another episode of the Your Company Health Podcast. Today we have Sapna Shah-Haque. She's a practicing internist and also a podcast host of The Worthy Physician. Sapna, welcome, and how are you?
Doing well, thanks. Excited to be here, actually.
Yeah, and I'm excited that you're here. I've seen all your good work on social media and what you're doing in this space. So to get things going, I want to tell us about your background and your journey in healthcare.
Absolutely. So I'm a practicing internist in rural Kansas and have been here in rural Kansas in one way or another since 2013. Really started out as engineering, electrical engineering, realized that I was more interested in the human body, the best engineered machine ever. And so switched my majors, dropped my engineering classes, and pursued medicine. Fast forward to 2016, went through my first round of burnout, or better labeled as moral injury. Didn't have the words to really describe what I was going through. My mom had a major stroke in March of 2016, so that kind of forced my hand to make some decisions, and so I decided to cut back on what I was doing and focused on outpatient only. Did switch jobs, had a couple of kids. Pandemic was about to hit. This was before we really knew what was going on. Decided didn't want to raise kids in a larger city, and pivoted back to a part-time position in rural Kansas. About 2019 in June, so at the end of this month, it'll be 6 years. My best friend, who is also a physician, so we met in medical school and did residency together, still in the same medical community, if you will. She died by suicide in her office.
Wow.
And there was a note that described she did not seek medical attention that she knew she needed because she was scared of professional repercussion. And so when that sits with you, and a year later, I just didn't know how to process that loss and all the emotions that were coming up. So I did go to therapy to help process this loss, but I also started reading, why would a physician want to take their life? And I was astounded that 300 to 400 physicians, and of course these are pre-pandemic numbers, but 300 to 400 physicians in the United States alone take their life. That's every year.
Wow.
So out of wanting to use my voice and a platform to get more answers, I started the Worthy Physician podcast. First few episodes, a lot of them are monologues. I also sat down with a physio psychologist who explains some of the physiology theories. Sat down with a couple of other professionals, but it was what was supposed to be like a monthly or bi-weekly kind of exploded when I had started having physicians email me say, I want to come on and tell my story.
So it's and that's a touching story and a touching background and how you're moving forward. And you touch a very important point of physician burnout. I know you're using your platform to highlight this story.
I think basically some of the key nuggets, remembering that we're all human, remembering that we need to follow the same advice that we give our patients, right? There's standard of care, and that also applies to us. The third is not to be disillusioned by the fact that you are human, right? We have to drink from that. We have to really sit with that. We get sick, we get tired, we have families as well. And, the family structure might look different for everybody, but we're still part of a larger network. We're still part of family, friends. We're a member of society. So it's remember to put on your own oxygen mask first, whatever that looks like for you. But it's okay to get off the hamster wheel and to design what you want your life to look like. For me, it's working part-time because I have young kids, and that's where I want to be on my days off, as well as attending to my own health. So it's for me, that's recharging, and so I'm 5 years into this schedule, and for me, it's sustainable.
Right. So where do you see the Word of Vision in the next 5 years, or what's your short-term goal? What are you planning to maybe be an internist full time, or are you planning to go full time in the podcast? Where do you see yourself in the next 5 years?
In the next 5 years, I would love to be able to maintain my work schedule as it is now: Tuesday, Wednesday, Thursday, and rotating Fridays. I see that not changing. Again, I have small kids, and I enjoy that time during the week to not only get ready for the week, but also to again address. I'm not getting any younger. I'm 43, and so I like to be preventive, and I like to make sure I keep up on my doctor's appointments, and I have several great reasons in addition to the kids to make sure that I invest in that. As far as the Worthy Physician, we'll be dropping an episode here at the middle to end of June where I have a co-host, and we're going to be discussing, I think, real life issues that happen with physicians and giving two different perspectives on mid-career. This physician, Dr. Muhammad, is early career. So it's going to be, I think, more having those discussions of maybe that we should have had during residency about life and medicine. And if I had to paint it with a broad stroke, I would love to see CME tied to the podcast, because we talk about we talk about physician well-being. We also talk about let's scratch that. We talk about physician well-being, which is it's not going to go anywhere anytime soon. And at some point in time, if I'm dreaming off the top of my head, would love to have that be the topic of a retreat.
Okay. That's just really cool. But you are off the bat, you touched on something that's very important, this quality of life, and it's not only unique to physicians, but for everyone, every business owner. It's so important that you focus on yourself first. You take care of yourself, because without taking care of yourself, I mean, you can't be able, you will not be able to take care of other people. Right, and you will not be able to sustain your business. So it's a very good point, and we all have to do some deep introspection in terms of how are we scheduling our days? Are we just chasing, and to what end? I'm not sure if you've read the book The Alchemist, right?
It's been a while, yeah.
Been a while, one of my favorite books, and the core of it is that we always be chasing something, but guess what? It's right where we are. We're always every day chasing things, but the thing that we'll be chasing is basically right here. So I mean, we go through life chasing the newest thing or the best thing, and try to do one up everything, like from business or all aspect of life, but then we create that level of stress and level of anxiety, and that breeds a lot of health issues, Organization, quality of life, that's what I get from, from your story um, and what you're trying to do. So let's talk about the business of healthcare. We see a lot of private equity firms. They're buying up these smaller private practices, and what's happening. The bigger organizations, they're owning most of these practices. So what that because I was talking to one of my clients, the local dentist, and we were just talking, and he was like, yeah, they're doing all that, and I'm not sure what's going to happen to my practice, because eventually he's going to be squeezed, and that happens to all aspect of healthcare, the way things are going now. So what that leads to, it may lead to a reduction in good quality of care, because the forefront is going to be all about business and profitability. What are your thoughts on that?
It's all about profitability. I mean, from the health insurance companies to private equity. And it's unfortunate because there are entities that are not in the exam room. In the exam room, it's the physician and the patient. And, these are entities that are saying, but do you really, is that really necessary? Yeah, I don't think it is. And these are entities that have never laid hands on the patient, so this is not a recipe. This is not a cookbook. This is medicine, and we forget that it is as much an art as it is science.
Mm-hmm.
I find that many things are not always typical presentation, so I would like to see this pendulum swing the other way.
Mm-hmm.
I don't really think that we waste. I think that many of us clinicians do our due diligence in ordering tests, and we don't do things just to check a box. We do things if it's actually going to improve the quality of life for the patient, and that's what it's about. So,
Right.
it is going to squeeze, and it is about money. It's not about the patient, and it should be about the patient.
Of course, and you're right. That's what it should be. But as you mentioned, from the insurance company to the private equity firm, it's all about profit. It's all about efficiency and growth and revenue. So I mean, it's going to be interesting to see how things pan out in the next 5 to 10 years, based on where we're going, and see the future of healthcare. Where we have AI coming on board. That's a big thing now. In terms of new innovation and telehealth and all that. What are your thoughts on AI in healthcare?
I think that if it's used appropriately, it can be an excellent tool. I don't think robots or AI will necessarily replace physicians, at least not in my specialty. We know insurance has been using AI to look at keywords in documents that are submitted or notes that are submitted for X, Y, and Z. So it's already here. Is there growth potential? Yes. If used correctly, can it make our lives better? Yes. Is it going to take the place of humans? I don't necessarily think so. I've read articles on, it's going to come for radiology or dermatology or pathology jobs. And I think that it can be used as a tool, but I don't think it's actually going to replace a person. Again, I'm not looking at it through a lens of those specialists or specialties, so I'm not trying to dampen the actual concern. But I mean, personally, I would not knowingly support a practice that used only AI. I mean, again, medicine is as much a science as it is an art.
Yes.
And part of the art is human connection.
No, definitely, and that's a big thing. We can never replace the human touch, right? We can never replace that. But Sapna, if trust me, I wouldn't have imagined before COVID that I could sit at home, just pull up a camera and speak with my doctor. You know,
Mhm.
yeah. So I mean, with that, so with that newness of telehealth, and people realize that, hey, I could just, talk to my doctor. I don't have to go in the office. Um,
Mhm.
so I think AI is an automation, and it's coming on. It's coming on very quickly.
Mhm.
So I don't. I can see the day where I could just go online, type in my symptoms, whatever I'm having, and then the system just sort based on my health insurance, sort the best doctor for me, and the doctor can immediately, or maybe there's some AI agent there, AI doctor agent or something, and they can write me a prescription, or they could diagnose my issue, and then I could again search, go on Amazon pharmacy, get my prescription. I don't leave my house. you know uh so it's I'm totally with you that it's not replacing physicians, but um there's going to be innovations that, and in every sector, not only in the healthcare, across the board. You know, I was reading where even salespeople, I was reading where they're creating these AI agents to make phone calls,
Mhm.
to prospects, and things of that nature. So it's going to be very interesting, although.
Yeah, and the thing I think, like, and AI is going to be great for like certain specialties, or telehealth. Um, I think where it gets a little hairy is if you have more comorbidities or more medications, um, and it's not a very straightforward case. So I think that if we paint with a broad stroke, yes, it's very possible, almost like urgent care, but on telehealth. And I think insurance has, talk to a doc, and if you have a rash or something, it's um, pretty when used in the right instance, it can be very helpful. What I would caution individuals to, don't let that be your primary care. And there's also limited physical exam with telehealth and AI currently. So I would like to see more like units actually available so we can auscultate and things like that. So like a stethoscope or an otoscope that can be used virtually. I think that's where it gets complicated and where things can be missed.
Right, right. Yeah, and I agree with you. It will definitely enhance processes, and that's
Mm-hmm.
why it's gonna be just AI is just it's just fascinating. The whole thing each day is like something new, and even who knows what robots are gonna do. Robots are on the assembly line making cars. Robots moving around. So I mean, but again, the key thing is that you cannot replace the human touch. That's the key thing. That's gonna always be there. And Samne, as I mentioned, and you may know that I'm in the digital marketing space. What are
Mm-hmm.
your thoughts on digital marketing in healthcare?
I think when targeted to the right audience in a time slot where we're not being caught between patients, I think it might be all right, in
Hmm.
a sense of sometimes if it's at the wrong time, and let's say it's peak volumes for the clinic, then it's very anything coming through the doors that's not patient related is distracting.
Right, right. Because I noticed I mean, you're pretty active on LinkedIn. So
Mm-hmm.
you're on social media doing your thing.
Yeah,
So have you ever used like LinkedIn ads or
I have not. I have not. I have a virtual assistant that helps with posting, and we discuss what's going to be posted throughout the week, and
Mhm.
then it's me responding to conversations So I'm active on LinkedIn, but it's not during business hours of the clinic. I mean, I think marketing is part of life, right? And that's how we get things in front of people. So, as I'm not against it. I'm not against it. Um, I'm a capitalist. I love capitalism. I love capitalism. It's one of the best things about the U.S. The difference is capitalism with a conscience. So we need
Yes.
to look at where does the crux of profits and healthcare intersect, and not go beyond that, because you can't put profits before humans. You can't. It's not ethical. It's not pro-life or anything. Um, so from that standpoint, I'm all for marketing.
Mhm.
I'm not. I don't like it when I'm working. So, but when I engage with it, it's not. It's going to be after hours.
No, and the funny thing is, or the great thing is that you touched on the very important aspect of marketing, which is targeting. So
Mm-hmm.
that what you mentioned is spot on, because I mean, it doesn't matter what we're doing in marketing if we're not targeting the right people, it doesn't make sense, you know?
Yeah.
So we like to just throw in the spaghetti on the wall. So that's why, when we engage a doctor or health practitioner, we have to fine tune that targeting. If you're a dentist, you're trying to find, say, a specific level of income of patients, then we can target in a specific area. Or, if you're a chiropractor, you're looking to find patients in a specific, we can narrow down and target to ensure that whatever we're doing, it's reaching those customers or
Mm-hmm.
patients, so that they, bring those patients in the practice. So as you mentioned, yeah, it's part of life, and it's a part of it's the part of the process of scaling a practice. So imagine you're new out of med school, and you don't have a book of business, and you definitely want to get your name out there. So digital marketing definitely has to be a part of the mix. And what we spoke about in terms of online in innovation, your website is like your new business card, right? In the age of telehealth, people can go on your website, schedule a visit and all that. So that's important, and it's important to have that effective online platform so that the patients can find you. But yeah, it's a part of the whole process in growing that practice. But I know we're we're moving fast, but um, I know you touched a little bit on the podcast. So tell us a little bit more about the focus. Is just like any practitioner, or what's the who is the best doctors? Who are the best doctors you're trying to reach?
So it's mid-career physicians that I think we go through. We've gone through the growing pains of entering practice, whether that is employed or private practice, and now it's okay. I have multiple roles in my life, or this is not what I imagined medicine to be. Because what we're trained for in medical school and residency is completely different than real world medicine. Because now, what's an RVU? What does that mean? Um, so it's that physician that's mid career thinking, what in the world did I sign up for? This is not how I had imagined my role as a physician. Dot dot dot. So what does that mean? Is this what's good? Is this what forever is going to be like until I retire? And the answer is it can be if that's what you want it to be. But if you don't want it to be that way, what are some steps, tools that you can use to make that shift? Whether it is dealing with imposter syndrome, whether it's dealing with wanting to scale back, whether it's wanting to pivot. So the stories of physicians that I have brought onto the podcast highlight that it's not um, an isolated story or feeling that you have. It is possible, but it will take some time, and you can start at point A and get to point B, C, and D by doing certain things, or hey, this is the roadmap I used.
Awesome. And definitely I will look around, and if I'll from time to time I can send you a recommendation. Your team can do the interview or and see if these people or these physicians would be the best for your podcast. But something that has been great, I think. I learned a lot. Your story is very touching in terms of how you got into this, and to move from studying engineering to practicing in internist. I mean, that's a shift. But what that tells us is that you have to follow your passion, and prioritize quality of life. Quality of life. That's what is important. Because at the end of the day, family is what's important. When all is said and done, all the career moves, and all seeing all these patients and doing what you're doing, and it comes right back to family. So if you can focus on family on the onset, then a great lesson to be learned there. But yeah, appreciate you stopping by. I know you're super busy, and until next time, thanks for stopping by.
Thank you.
Thank you so much for joining us today. I hope you found this information useful. Please share this episode on social media, and also visit our website at andreewright.com/podcast for more. And also leave us a review on Apple or wherever you get your podcasts. Until next time, see you then.